So, hi, my name is Jessie. I'm going to be your nurse, and I'm going to be doing a quick respiratory assessment on you. So first I'm going to ask you a few questions. Have you been experiencing any cough lately?
No.
No. Have you been having any chest pain, chest discomfort?
No.
Okay. Have you, do you smoke?
No.
No? Okay. Are there any environmental factors that might affect your respiratory?
No.
Your immunizations, are they up to date? Influenza?
Mm-hmm.
And have you been tested for TB?
Yes.
Okay, great. So now we're going to do a quick inspection on the patient. We're going to inspect the chest, and we're going to see it is equal bilaterally. We're going to see the skin. There's no rashes, no lesions. It's intact, no cyanosis. Patient appears relaxed, sitting upright. There's no respiratory distress. I don't hear any loud stride or wheezing. And also, she's not in a tripod position, which you might find in a patient who has COPD. Also, we're going to do a quick set of vital signs before we continue on. Most important is to count respirations, and what we usually do is check the patient's pulse, but at the same time we're looking at their respirations so that they're not aware that we're looking at the respirations, and then they might breathe a little faster than normal. So the next section is going to be palpation. We're going to start off with the symmetric expansion of the chest. We're going to place both hands at an angle right above below the xiphoid process, and we're going to ask the patient to take a deep breath. Great, and let go. Great. So we want to make sure that our hands expand equally and symmetrically, which they did in this case. That's a normal finding. Then we'll go to the back and do the same thing. Okay, so you will find abnormal findings with the symmetric expansion when there might be a tension pneumothorax or atelectasis where both lungs are not expanding equally. Second, we are going to do fremitus. We're going to test for fremitus, which is vibration, so you can use the palm of your hand, or you can use the side, whatever you feel most comfortable with and wherever you feel the vibrations best. So we're going to do the chest anteriorly. We're going to ask the patient to repeat 99. So repeat.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, great. And then posteriorly.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, great. You want to make sure that you're not putting your hand on the scapula or on any bone, because you won't feel vibrations there. And also, increased vibrations would be when there's consolidation, pneumonia, and then decreased vibrations would be when there's hyperinflation of the lungs, emphysema, a lot of air. The thing we're going to do is percussion. You're going to use finger, put 2 or 3, you're going to tap with your fingers, and you're going to listen for the resonance. So, I'm going to go. Always do side by side in a zigzag formation so that you can test it bilaterally.
Oh my god! Kristen, I don't know which one's yours and which one's
Okay, great. And then posteriorly, bilaterally as well.
No, I had it coming deep in the beginning, but some other people, they're very
Again, you don't want to do it on the bone, because you will not hear any resonance.
Yeah,
And do not forget about the sides. So last is going to be auscultation. We're going to listen to the patient's lungs, anteriorly and posteriorly, and we're going to first ask them to take deep breaths. So I want you to take deep breaths as I move my stethoscope across your chest. And if at any point you feel dizzy or lightheaded, let me know and we can take a break. Okay. And it's most important to ask that for these patients because they are most likely respiratory patients and already experiencing some respiratory distress. So we're going to listen with the same zigzag formation we've been doing all the other assessments. So take a deep breath, please.
I'll do it.
Okay, so the equipment that
Great. And posteriorly, same formation. You don't want to put your stethoscope on the scapula. And also, you never want to put the stethoscope on clothing, but for this demonstration reason, we're going to be putting it over clothing. But always stethoscope to the skin. Okay. So some abnormal lung sounds that you might hear are crackles with pneumonia, any fluid in the lungs, wheezing with asthma, stridor with any obstruction in the airway, and are there any other?
Pretty much any sound, it's good to know the normals to then be able to differentiate with what's abnormal, and that would be mostly the wheezing, the stridor, crackles, bronchi, all those that are deep, and then different ones that are more high pitched.
Thank you.